My top 4 core exercises for an L4, L5 disc herniation, especially safe for L4, L5, L5S1 disc herniation. Most core workouts are a trap. If you have an L4, L5, or L5S1 herniation, some core exercise could be making your leg pain and sciatic worse, not necessarily better. I've helped thousands of people safely rebuild their core without triggering that leg pain or sciatica. And the secret isn't more planks or more crunches. It's using exercise that stabilize your spine without compressing it. In this video, I'm going to show you the 4 safest, most effective core exercise for disc herniation recovery, the kind doctors rarely talk about, but that have helped real patients just like you reduce pain and build strength so you can go back to doing all the things you want to do. And for each one, I'm going to walk you through a beginner or easier version and a little bit more advanced version, so you can safely progress as you get stronger. You're going to learn how to avoid the hidden triggers most rehab plans miss, how to level up without risking re-injury, and how to feel stronger in just 4 weeks. Stick around, especially if you've been afraid of making things worse, because I'll also show you the one red flag symptom that means you need to stop immediately. If you miss this, you can make your disc herniation and symptoms permanently worse. Hello, I'm Dr. Gregory Kramer. I'm a Livonia, Michigan chiropractor. I have over 30 years of clinical experience, advanced certification in chiropractic biophysics, which is the _1 structural rehab technique in the world. I specialize in treating people with chronic health problems like chronic neuropathy, chronic L4, L5 disc herniations, chronic knee problems, chronic foot problems, and a host of other conditions. Now, what do I use? I use a variety of corrective methods, not just to get you out of pain, but to correct your spine so that you have long-term pain relief and a strong, stable spine so you can do the things you want to do. Commonly, we're going to use very specific mirror image adjustments. Mirror image traction. Mirror image means it's the opposite of your alignment, and targeted exercises and non-surgical spinal decompression. Before I continue with this video, I need you to hit that subscribe button if you want to learn how to eliminate pain, stabilize your spine, and avoid surgery so you can live stronger longer. Now remember, stronger longer is an individual thing. Whatever your day includes, I want you to be able to do this. And so our goal is to get you so you can do the things you want to do, to take some self-responsibility, learn how to ask good questions, whatever doctor you seek, and so that you can be a co-owner in your health quest. All right, so when we talk about the 4 core exercises, you will notice that I have some videos we did approximately a year ago. So I've seen thousands of patients over the last 30 years, probably over 200,000 office visits, maybe close to over 300,000. Also, I have also been a patient. I've had a bad disc. Okay, I've had a huge L4, L5 disc extrusion, which is a nasty type of herniation. There's protrusions and extrusions. And so I'm going to share with you what I've done for myself and what I've done for other people. Now, the first thing we got to talk about is the red flags. Some of you need to go to the surgery immediately, okay? So you need to go to the hospital right now if you've lost control of your bowel or bladder. Okay, I don't mean your streams got a little weak. I don't mean that you're getting a little constipated. I mean you cannot control eliminating, or you've drinking a ton of fluids and you're still not urinating. That means there's pressure on the nerves that control your bowel or bladder. That's what we call Cauda-Equine syndrome. Very rare, but it can happen. The other thing you want to be aware of is, where are you? Is this an acute injury? Many of you have had chronic disc problems and then you flared it up. So it depends, where are you in your recovery? The first week or two? Sometimes there's nothing you can do for a day or two. Sometimes you might need to just ice up your back. You might need some over-the-counter medications, and you might need to just lay down, kind of like a dog crawls underneath the house, all right? Bottom line, most people do not need surgery. In my experience for myself, probably 95% can avoid surgery. However, we talked about the red flags, but you need to get through that first week. That first week is terrible. Chronic, many of you have chronic health problems with a flare-up on top of that. So let's assume you got through the first week. Let's assume you can start walking. And the #1 concern is, What do you do that makes it feel better or worse? In general, and I've got a video of this. You go back under my L4, L5 disc videos. This is kind of a recap. Most people, either they feel better leaning back or bending forward. Most people will either feel better sitting or standing. So if walking helps your back, let's assume walking helps your back, then you need to go for a walk, okay? And you need to avoid sitting. So many of you can get a lot of relief if you go for a walk, you have a lumbar support that creates a little bit of an arch in your low back. So you have a support in your lower back, and that helps to maintain that while you sit, if you have to sit. So that's the first thing. What position gives you relief? Okay, now if you're really inflamed, there'll probably be no position, all right? And so you need to pay attention. Do whatever feels good to you. Some of you may need to lie over a football, okay? And we'll talk more about that on the next visit, but usually it'll either feel better bending forward or leaning back, all right? So you need to find the position that gives you the least amount of pain. For some of you, just lie on your side, a pillow between your knee, that might be the best. And one side might feel more comfortable than the other. So again, we want to find the positions that give you the greatest amount of relief. Also, we'll talk about centralization of pain. That the pain should be getting centered to the spine versus going down your leg. And I'll show a picture of that in a little bit. All right, so I'm going to show you the 4 best core exercises when you have a herniation. Now remember, what you do at the 2-week, 4-week, 6-week mark is different than at the first 2 weeks. So do whatever you got to do to get comfortable. Most people will feel better in extension, leaning back, or flexion, bending forward. Whatever helps your back and leg. So let's assume your back and leg feel better with flexion. A simple thing you can do is lie over a fit ball like this, and that may give you tremendous relief. All right, that's a simple thing to do. If you feel better, and particularly if you're over 50, probably flexion will feel better to you. If I had to generalize, generally over 50, there's more degeneration, there's less disc space. So if you're under 50, generally extension might feel better, where you lie on your stomach, okay, and very simply you just press up like this, or you might just lie with your hands like this, whatever feels better, okay? Some people just lying face down may feel better. Now, that's important to get out of the way. We made sure that you don't have any serious cord compression. That means you don't have problems going to the bathroom. You don't have problems losing control of urination or bowel movement or anything like that. So for those of you that can move around, we start with making sure we get some general mobility. We call it the cat-camel. You're on your hands and knees, and it creates mobility without loading the spine. Okay, you can put a pad under your knees, and it's a very simple exercise. Stomach goes up, head goes down, just like this. Approximately 8 to 10 times. Go as far as you can that doesn't hurt. If it hurts your back or leg, don't go that far. It's a very simple warm-up. Now, when we talk about core, we're talking about the front, the sides, and the rear. So after we warm up, now let's working on the front. All right, I'm going to show you an easy version, then I'll show you an advanced version. I'm going to recommend sets of 10 reps on all exercises. And you could start with 1 set of 10, and every couple days add a couple sets till you work up to 3 sets of 10. So while you lie on your back, very simply, what you're going to do is something called a curl up. You lie flat on your back, one leg is straight, one leg is bent, and you just curl up. Very little rate motion. You hold it for 3 seconds and back down. Now, if you want a harder version, okay, some of you want to make it a little bit harder, then you could do, instead of having your you can lift your leg up, keeping your back flat. So your foot is off the ground, your leg is off the ground, and you come up. It's like a hollow body in gymnastics. So this is the easy version. The hard version, your feet are off the ground. You also can do something called a plank. All right, I'll show you an easy version. So this is for the front of your stomach. And the easy version, you just you're on your knees and you hold with a tight stomach. A hard version, you're like on your toes and your elbows. Your whole focus is keeping your stomach tight. Now, you might not be able to do that the first 2 to 4 weeks, so you only do what doesn't hurt you. That's for the front of your stomach. If you want to make it even harder, so you can do the curl up, the hard version, the easy version, you can do a plank. You can also do something called a stir the pot. Now this is a very advanced version of working the front of your core, and very simple, just like it sounds. We're starting with 10 reps. That's going to be hardest. This is not for the beginning. This is after the disc is healed, but this is something down the road, 4 to 6 weeks later for an athlete. So this is a very hard one. The next, we work on the side. So we work the front, we're going to work the side. You're probably familiar with side planks. Let's show you an easy version. If I want to work the muscles along this side, what I can do is hold a band and walk away. As I walk away from the wall, I am using these muscles so I don't tip, so I don't twist. So I'm walking away. These muscles here are activated. I'm holding the band, hold it for 10 seconds, and step back. Then I would do both sides. Okay? That's called a walk away. That's for the side. That's an easy version. If you have shoulder problems, you can do this. Another version for the side of the core is you hold a weight, get something that you can use for support if you need it, and you just march. Tight stomach. March. And if you need support, you put your hand here. If you don't, you don't. This is using your core, and your spine is not moving. So you march, and as you get better, you hold it longer. So you're just marching, and I recommend 10 reps holding the weight in each hand. Now remember, when the weight's in this hand, we're working this side. Now, we can do another core exercise working the side. So if we want to work this side, we would do a side plank. All the time when we do the core exercise, think about keeping your stomach tight, keep about thinking your rear or buttocks tight. We want no movement in the spine. You should have zero pain in your back or leg. The whole key with stability is you're able to move your spine without any pain or irritation on the nerves. So you should feel no pain anywhere, okay? This is what a side plank looks like. What I recommend is do 3 sets, starting with 1 set. Instead of repetitions, we're gonna go for time. So start at 20 seconds, gradually work up to a minute. So if we're gonna be on our side and we wanna work the right side, we would do a plank like this, where our feet and arms are on the ground. If you wanna make it easier, you can go from your knees. If you wanna make it harder, you go from your feet. Tight stomach, your head's in alignment. Now, if that bothers your shoulders, I showed you the easier versions first, with the walk away or the marching. Okay, so our final exercise for the top 4 key exercises for your core is the bird dog. That works the back side of your body, or the back of your spine versus the front and the side. And we can show the easy version first, where we just move an arm and a leg. Okay? So, easy version, 1 foot, your spine is level, hold for 5 seconds, bring it back, push with the heel, hold for 5 seconds. Okay, the hard version, and the whole key to this, we want to keep our spine level. We want to move our leg and our arm without any spinal movement. That's hard. So visualize you're on a white carpet. Visualize you're balancing a glass of wine on your back. Very slow. So if you can do one leg, and then after we do one leg, you do one arm. When you could do both of those, then we do opposite leg, push with the heel, with the arm, and we try to move the arm and leg without moving your spine. So now, if you want to make it even harder, there's always ways to make things easier and harder. If you want to make it harder, instead of our hands and knees, we're our hands and our feet. And now we do one leg. Or just do the leg. So you can always make things harder, or you can always make things easier. Now remember, nothing should hurt you in any of these exercises. You should not have increased back, buttocks, or leg pain. All right? So our goal is to work up to 3 sets of 10, and we want to create an environment where our spine is stable. So remember, we train the front by either doing the planks, or we can do the harder version of we can do curl-ups, and we can make everything either easier or harder. We want to work the sides by either doing a side plank. We talked about the walk away. We talked about marching and lifting, okay? And make sure none of this hurts you. These are all simple exercises you could do at home, and you don't need a weight. You can use some luggage and just fill your luggage with clothes, and you could walk through the house carrying it on one side. That works part of the side. Just remember, start slow. Nothing should hurt you. Do less, and make sure that it's comfortable, and make sure you gradually progress and add more as time goes on. Now, one of the things we want to talk about is how do you progress safely? So remember, you always want to keep your body in alignment when you do an exercise. That means from the front, our shoulders should be level, our head should be level. But more importantly, from the side, our ear should be over our shoulder should be over our hip. So make sure we stay in alignment. Don't let the head go forward. Don't let the head crooked to the side. Also, like I said, like if we're talking about the curl up where you lie on your back, when 10 reps is easy, gradually build up. When you could do 3 sets of 20 instead of 3 sets of 10, start making it harder. Use the harder versions. If you irritate it, then back off. Everybody has some flare-ups throughout the course of healing. All right, just make sure that you progress slowly. Again, when you can do 3 sets of 10 easy, then you go 3 sets of 12, 3 sets of 14, 3 sets of 16, 3 sets of 20. And then you can gradually increase from there. So one of the key things we want to make sure is if you have leg pain, stop immediately. Sharp nerve pain before, after, or during the exercise. Because if you ignore this, you can make a herniation worse. Again, it's not a push through it, no pain, no gain. Absolutely not. Exercise should cause no pain in the joints, in the back, or pain going down the leg. Now, of course, your muscles might feel it, but that's different. Now, I would expect you within 4 weeks, if you do this 5 minutes or so twice a day, within a week or 2, you'll feel different. But absolutely, you should feel stronger in 4 weeks. So write down your numbers. Record keepers are record breakers, and I mean that. Record keepers are record breakers. Pay attention to your alignment. Don't overdo it, but try to progress slowly. Healing takes time and repetition, and progress is possible if you're methodical. All right. Right now, you guys have a set of safe, effective core exercises designed to specifically for your disc herniation recovery. These exercises are here to help you heal safely, avoid setbacks, and rebuild your strength with confidence. Now, come back to this video as often as you need. Practice with intention. Focus on good form and take it one step at a time. If you do these correctly, this is going to help you avoid re-injuring, speed up your recovery, and get you back doing all the things you want to do. Now, here's what these movements can do for you. They can obviously help you reduce pain, especially nerve pain. They're going to improve your core stability, and they're going to support long-term disc recovery. Now, what I'd like to do is I want you guys to drop a comment. Let me know which exercise helped you the most. Let me know if you have problems with the specific ones. If you find this video helpful, do me a favor, give it a like, share it with someone who needs it. And if you want more step-by-step videos to guide your recovery, feel free to subscribe. The next video you guys should watch is the L4, L5 disc ball treatment using safe, non-surgical spinal decompression. Watch it now, see exactly how we relieve disc pressure, reduce nerve pain, and help patients avoid surgery safely and naturally.